At some point or another, with the busy schedules so many of us face, getting tired can be just a normal part of life. But should fatigue disrupt your daily routine? And is caffeine the solution? Well, here to break down why so many people are tired all the time and how it can affect you physically and mentally is Dr. Kent Holtorf, the medical director and founder of the Holtorf Medical Group, which specializes in the treatment of fatigue. Dr. Holtorf, thanks so much for joining us today.
Hello, good morning.
So it seems that so many of us have hectic lifestyles these days, and so many people seem to be tired all the time. Is this an increasing medical problem, or is being tired just a normal part of modern life?
It really is an increasing problem. I think the biggest problem, though, is our patients going to their doctors and saying, I'm fatigued, and the doctors just say, well, you just must be depressed, you're just stressed, not getting enough sleep, and not doing thorough diagnosis and really looking for the underlying problem, because the fatigue is treatable over the overwhelming majority of time. So really they need to look deeper at when you have fatigue.
So tired is one thing. That's something that can probably be solved with a good night's sleep. Fatigue is another, and then chronic fatigue syndrome is yet another. Is that correct?
Correct. And they're different in that, fatigue, basically, when you basically can't do the things that you want to do, you get a good night's sleep, you're still fatigued. Chronic fatigue syndrome, why do we care if you have that versus regular fatigue? Because there's common pathophysiology and it's very treatable if it is diagnosed. So an easy way to differentiate is that if you have chronic fatigue syndrome, you'll typically have, no matter how much sleep you get, you're still fatigued, along with muscle pain, cognitive dysfunction, so difficulty concentrating, difficult with poor memory. And a big one is if you exercise or are stressed, you get much worse. So that's an easy way to differentiate between potential chronic fatigue syndrome and just run-of-the-mill fatigue.
Do you also have physical pain throughout your body?
That is, more fibromyalgia, but with fibromyalgia and chronic fatigue syndrome, they coexist about 70% of the time. They're just been diagnosed by two different entities. So one is this CDC, the Center for Disease Control, set up criteria for chronic fatigue syndrome, while the American College of Rheumatology set up criteria for fibromyalgia, which involves tender points.
Right.
But again, they're likely the same illness and treated very similarly.
Well, you said it's important to get the diagnosis because the treatment can really take care of it. What is the treatment?
Well, so when you have, the problem is many doctors feel that chronic fatigue syndrome is just a wastebasket diagnosis. If you don't know what it is and you just call it chronic fatigue syndrome, say, well, here's some antidepressants, some pain medications, and you're on your way. But we can pick out those illnesses, chronic fatigue syndrome, fibromyalgia, 90% of the time on blood tests. But the problem is there's no simple cause. It's multifactorial. Maybe chronic infections, low hormones, sleep disorder, mitochondrial dysfunction. Mitochondria make the energy for the body. They're shown to be dysfunctional in these conditions. So really you got to find a doctor who looks at those underlying problems and treats those rather than just using the catch-all phrase.
So the treatments vary significantly depending on what your doctor determines is the cause of your chronic fatigue syndrome. Is that right?
Absolutely. The problem is most doctors don't go any farther than just saying, oh, you got chronic fatigue syndrome, here's an antidepressant, fibromyalgia, here's some Lyrica, you have to live with it, and you don't.
So what can people do before? I mean, how can we prevent the onset of chronic fatigue syndrome?
Well, the problem is it is multifactorial, and stress plays a part, and that's why I think it didn't get a lot of credibility, and some doctors still think it's psychological illness because stress oftentimes precipitates it. So stress will lower the hypothalamus and pituitary function, causes low hormones that aren't picked up on standard blood tests, then immune dysfunction, then chronic infections. So again, it's a vicious cycle of a lot of things, and there's many treatments, but it depends on what's really causing that person's chronic fatigue syndrome or fibromyalgia.
So do you think that chronic fatigue syndrome, though, now is a little bit more widely accepted and you can go to your doctor and say, please continue to try to figure out what the source of this is so we can treat it, even if at first they say, hey, take this?
Right, it is in the literature, but still doctors aren't accepting it because if a doctor can't treat it, they don't think it exists. And the treatment's very poor. The overwhelming majority of patients aren't getting diagnosed. And when they do, the doctors don't know how to treat it. They're not trained.
Right.
So that is a big problem. That's what we've been doing with our centers is really educating physicians and educating patients on how to get properly treated.
So what's
in
the
our
biggest,
study that
I'm sorry, because we're running out of time. What's the biggest piece of takeaway advice you'd give someone who thinks they may be suffering from chronic fatigue syndrome but doesn't feel like they're getting the help and the support they need?
Well, I think the biggest thing for both fatigue in general and chronic fatigue syndrome is look at the thyroid. And the problem is you go to your doctor, you say the doctor says your thyroid's fine based on a simple test called the thyroid stimulating hormone, TSH. The problem is that test is missing the overwhelming majority of people with low thyroid, and just simply treating the thyroid can really improve chronic fatigue syndrome and fibromyalgia as well as regular fatigue. So if any one thing, really get that thyroid level checked.
All right, Dr. Holtorf, thank you so much. And for the latest health news, be sure to visit the health page at abcnews.com.